Hello, in this video I'd like to show the current state of the Python Panda 3D version of NERV. At the moment it handles cranial nerves 2 and 3 as well as the sympathetic nerves that are related to the pupil. There are plans to add more. I'll talk about that in a little bit. But this right now is focused on providing a way for teachers to specify a list of disorders of the eyes that the students would then have to identify, sort of like a test scenario. I apologize for this horrible GUI. I'm going to rip that out shortly, but it's good enough for this demo. So you can see here there's two buttons underneath each eye, and by clicking on them you can specify what disorder you want this eye to have. So for instance, if I give this one 80s pupil, you can then see the pupil dilating. And now I have the slider come up here, which will let you select how big or small of a pupil you want. I'll make this one decently big. Okay, and you can also select the other eye. For instance, I'll give this one a nerve 3 palsy and drag that one over there. You can see the eyelid closing. While you're doing this, you have the ability to use all the tools that a student would. The tools are listed up here. I don't know if you can read that. You have cocaine, 4% drops, hydroxyamphetamine drops, pilocarpine at 0.065% and 0.25%, and finally you can pull up on the eyelid. So for instance, if I were to use that tool right now, you can see the effect there. I'm going to reset, and now I've decided that this patient is good enough. I'm going to add it to my patient list, accept the name, and I now have a new patient that I can also give disorders to. Let's give this one central Horner syndrome. Make that pupil really small. Add it to the list. And we'll give this one anoscoria with a medium pupil. Okay. After I've done this, what I'm going to do is save the list of patients to a file, which can then be played for the student. So I'm going to save this to patients.nrb. And okay, so as far as the teacher is concerned, they're done. I'm now going to run it in test mode. Okay, so here, as you can see, all that extra GUI is gone now, and we are left with just these two buttons for going between patients down here. You can see this is the one that I had 80s pupil and nerve 3 palsy. At this point, the student would have to identify what's wrong with the patient, and they have a couple of tools to do this. For instance, if I select the pilocarpine drops at 0.065% and then click on the eye, you can see that a timer has come up here. This is showing that time is passing much more quickly than it would normally, and at about 60 minutes we should see the pupil has constricted. I can also pull up on this eyelid. I'm going to see with the nerve 3 palsy that the pupil is dilated, and then reset all my changes. This patient is different, this patient is different. So what we like to do in the future is to incorporate cranial nerves 4 and 6 to finish out the eye movement. It looks good now, but you can't disable it other than turning off nerve 3. And then we like to do cranial nerve 5 and 7 for the blink reflex, and adding a Q-tip like tool for causing the patient to blink. After that, the tools will be displayed in the actual simulation, so you don't have to just use the mouse. You'll see like an eyedropper for the Move itself, the PlayStation Move itself, so you can have better positioning. And finally, the UI is going to be greatly overhauled to make this non-horrible. Alright, thanks a lot.